While we are waiting just a second, I want to share a couple of things with you. One, I want to do another thank you to our sponsors who make programming like this possible. The Daytona International Speedway, Giabi Consulting and Management, Charter Spectrum, FPL and Foundation Risk Partners, and AT&T. Without their support, these kinds of programs don't take place. And I think I feel confident in saying the information we've had shared with us to this point in the afternoon has been really, really insightful for the business community. So glad to be able to bring this type of information to you in such a critical year. The other bit of news I would like to share with you is we have an addition. If you take note on screen in tomorrow's itinerary, we mentioned earlier that at 10:30, Jamal Sowell from Enterprise Florida will be taking that slot. He had to reschedule from this afternoon. But at 9 a.m., we've also added Andrew Wiggins, who is the Senior Director of Political Affairs and Coalition Advocacy for the Florida Chamber. Will provide, I think, some tremendous insight into the current legislative session as well. So that invite should have been updated. You should have received an email that was updated. So the link will be the same one that was for that time slot, but we will have that filled with a really good presentation. So with that, we'll get started on this 3:30 program. My pleasure to introduce once again Cheryl Coxwell from NASCAR and the Daytona International Speedway. Cheryl, the floor is yours.
Thank you, Ken. We are very happy today to have Mary Mayhew with us this afternoon. Many of you have heard her name over the years. She was most recently the Secretary of the Florida Agency for Healthcare Administration, AHCA. And she was responsible for the Health Policy Administration and of the state's Medicaid program. Before that, she came to us from Maine. We were glad to have her come here. I'm actually just a little warmer here right now than Maine. But she was the vice president there of the Maine Hospital Association. So her new position with in the state of Florida is the president and CEO of the Florida Hospital Association. And they're obviously a large group that advocates on the state and federal levels to ensure that the 200 hospital and healthcare members have the funding and resources that they need to provide the patient care and community service. She, as I said, grew up in Maine and holds a bachelor's degree from the University of Arkansas. So she made it south early. Thank you for joining us today, Mary.
The phrase of 2020 and 2021, you are muted. Thank you, Cheryl, so much for that introduction, and I am absolutely delighted to be with all of you again. It's hard to know where to even begin with this discussion, but I'm going to dive in to the role that I most recently played, and I will segue quickly to my current role as president of the Florida Hospital Association. But as you know, I served Governor DeSantis as Secretary for the Agency for Healthcare Administration. We will talk a little bit more about the role of the state in helping to support a healthcare vision through the Medicaid program. But here we are hopefully emerging from the pandemic. I served with the governor, with the Surgeon General, with Director Moskowitz, in helping to orchestrate the state's response to the pandemic. And I wanted to just touch upon very briefly what we experienced as a state and where we are today. And honestly, I think as we look at the demographics in Florida, I remember very well in early March, as we looked at Florida and the risk associated with COVID-19 related to our elderly. And here we as a state have 4.5 million individuals over the age of 65. You all may recall early on in the pandemic in the state of Washington, a very high profile case situation unfolding in a nursing home in Washington state. That was a strong and clear signal about the most vulnerable populations in our state. And yet, as you know as well, this was a virus that we were learning something new about almost every day. And when you think about Florida's preparedness for emergencies, we do need to reflect on, in our response, why I believe we have fared well, given the risks associated with our demographics, the number of individuals over the age of 65, the presence of our nursing homes and assisted living facilities. Again, those were settings that clearly were vulnerable to rapid spread of the virus. Much of it comes back to the nature of how we are organized for regional responses. The approach that was taken by the state was really to focus on federal and state guidance, federal and state resources, but regional responses, right? That is the motto in responding to hurricanes. Much of that informed the approach to responding to the pandemic. I had the privilege of serving at the agency and working closely with hospitals and nursing homes and assisted living facilities and county health officials and county emergency managers. And the level of collaboration and coordination really can't be overstated, and how critical. In Miami-Dade, Broward, Palm Beach, those hospitals and county officials have been meeting at least weekly since March, and talking about their various experiences, sharing data. And I know that that is repeated throughout the state in different regions. I share all of that in some ways to create a bridge to where we are today, but I don't want to lose sight of the strong foundation that has either been established or strengthened in so many parts of the state as a result of this pandemic, in terms of that level of engagement and collaboration and coordination, that we all need to think about how we sustain that and continue to capitalize on that. There are so many other challenges that we face regionally and as a state, from the behavioral health challenges and issues, the opioid crisis, transitions of care for our elderly. There are many other issues and challenges for which that foundation, that regional collaboration, will absolutely serve us well long term. I think that the issue that we often see is when your feet aren't held to the fire, when the crisis isn't at your door, how do you sustain the momentum? I do want to share, from the hospital's perspective, the Florida Hospital Association represents more than 200 hospitals here in Florida. Our job as an association is to lead on behalf of the healthcare community, to establish a vision for Florida's healthcare delivery system, to advocate related to policies that help to support that vision, obviously to be involved directly in the state budget, given the impact of the Medicaid program and the funds provided to support access to healthcare through the Medicaid program. But this last year, the dramatic financial impact on hospitals, I wanted to share. So we have surveyed all of our hospitals about the revenue losses. So certainly during the period where there was an overall restriction on electives, procedure services, and screenings that could be scheduled, all completely prohibited. And then certainly as the state saw the respective peaks and surges, hospitals independently in July and August, and then again in December, January, made decisions to restrict electives in order to preserve capacity. The revenue losses statewide, conservatively, from those restrictions is over $4 billion. $3 billion. The costs associated with the increased staffing, the overtime, contracted staffing, agency staffing, personal protective equipment, lab equipment, that is another $1 billion. Now, hospitals in Florida benefited, as hospitals did across the country, with the COVID financial relief funds from Washington, D.C. But you may be aware that there's considerable disparity in how those dollars were distributed around the country. So for Florida, we received approximately $4 billion for all healthcare providers. Hospitals received over $2 billion. There is still net losses that we conservatively estimate for Florida hospitals of over $2 billion. Let me just contrast that with the state of New York. The state of New York received $12 billion in COVID relief funds for healthcare providers. That was largely influenced when Congress was dealing with some of those initial tranches of federal relief funds. They were focused on hotspots, and those were hotspots as they existed in April, in May. And again, as you know, we experienced our peak, our first true significant peak in July. And the funds never really caught up from there in terms of the distribution packages from Washington. So, not surprisingly, in a downturn in the economy, the state is also struggling with a significant shortfall. I'm sure you've heard that from some of the legislators that have addressed you already, and those that are to follow today and tomorrow. The state is looking at an over $2 billion shortfall. Obviously, Florida depends heavily on tourism for its state budget, and clearly we have seen a dramatic impact on our tourism as a result of the pandemic and the restrictions on public access. As you know as well, in a state budget, to fill a shortfall, there are really only a couple places that you can go. You either raise taxes or you cut spending, and when you seek to cut spending to fill a general revenue hole, again, you are limited in terms of where the vast majority of the general revenue dollars are spent, and they are in education and in Medicaid. So the contributing factor to the shortfall in the state's Medicaid program is when you have a downturn in the economy, as we've experienced, and a dramatic increase in unemployment rates, you also often have a significant increase in Medicaid caseload, Medicaid enrollment. Florida has seen since March an additional 860,000 new enrollees in the Medicaid program. We are now up over 4.6 million individuals enrolled in Medicaid. That is the largest contributing factor to the state's Medicaid shortfall. Now, thankfully, over the course of this year and optimistically into next fiscal year, associated with the federal declaration of public health emergency, the federal government has provided all state Medicaid programs with a temporary increase in the federal Medicaid match of 6.2%. That has largely covered this significant increase in enrollment. Now, we know that enrollment is going to persist, that unfortunately our economy is not going to miraculously rebound and the unemployment rate isn't going to return to those historic lows overnight. We are hopeful that the federal government will continue to provide that temporary increase in federal Medicaid matching payments to support Florida and other states as we recover. Now, as you all know, additionally, the federal government just passed let me get this number correct, a $1.9 trillion relief package. Now, Florida stands to benefit with over $8 billion coming into the state. Now, again, optimistically, between those funds and the enhanced federal Medicaid match, we are hopeful that our hospitals in the midst of a healthcare crisis will not see hospital Medicaid cuts. While it is never a good time to cut reimbursement rates within a safety net program, it's certainly not helpful when we are trying to recover from the economic challenges associated with the pandemic. Let me quickly just, I know we wanted to get to some Q&A. Let me just quickly say, obviously, much of our focus will be on this budget as we're expecting the budgets from the House and Senate to be presented next week. Now, when the governor submitted his budget, he set the table nicely. It did not include any cuts within the Medicaid program. That to us is would be an incredible outcome with the legislature's budget, and we are again optimistic, given the relief funds that are coming to the state, that shortfall can be addressed without cutting reimbursement rates to providers. With regard to other priorities, let me just touch upon one of the silver linings from the pandemic has been the skyrocketing increase in availability and use of telehealth. Now, the pandemic has served as a catalyst for change. We've been working on for over a decade, increasing the use of telehealth. With the Medicaid program in particular, but this applies to certainly many populations, one of the biggest barriers to timely access to care is transportation. And while we can't and certainly wouldn't advise replacing all in-person visits with telehealth, telehealth can bridge and address that significant barrier in terms of a lack of access to transportation. Similarly, in behavioral health, when someone with mental illness is ready to access care and treatment, when someone with a substance use disorder is ready to receive treatment, the door needs to be immediately open. With a variety of barriers, transportation, limited rural access, workforce challenges, telehealth to support access to mental health services and substance use disorder treatment, again, huge benefit in addressing what has been a significant challenge for many, many years. There are a number of bills pending in the legislature that seek to sustain this commitment to telehealth, many of those pertaining to payment parity, to ensure that we can continue to build upon this momentum. One of the other big legislative priorities for us is the COVID liability protection legislation, which right now has significant support in both the House and Senate and is moving forward. Again, given the ever-changing state and federal guidance with this virus, where we were learning something new about near almost every day, we certainly wanted to make sure that there were reasonable protections for healthcare providers to insulate them against unwarranted lawsuits. So grateful to the House and Senate for their leadership and their commitment to moving that forward. As we emerge from this pandemic, there's much that we need to resume in terms of the focus on healthcare quality, reducing some of the complexity and the challenges of navigating a system that has become more and more complicated, the warm handoffs, the commitment to the continuum of care. Our hospitals are playing an ever increasing role in the community to support timely access to primary care physicians, pediatricians, specialists, mental health services. We need to support that patient-centric approach. When I was in Maine, I oversaw a large state agency, small state, large agency. It had every single program under one roof: child welfare, Medicaid, developmental disabilities, mental health, substance use disorder, food stamps. And I had the benefit of seeing through that agency, as you all know, individuals and families, their needs don't fit neatly into one program area, but span across often multiple programs. The opportunity to look more comprehensively at the individuals and the families, and to ensure that the right resources, the right care in the right location at the right setting, along with many of the social determinants of healthcare, employment services, educational services, that help to bring together and help support that more comprehensive approach that will help to improve healthcare outcomes and support individuals being independent and leading meaningful and productive lives. So obviously very excited about some of the foundation that's been established here in Florida as a result of the pandemic, and optimistic that we can leverage many of the best practices that have emerged from the pandemic in the best interests of moving Florida's healthcare delivery system forward. So really grateful to be with all of you again. Appreciate the invitation. And Cheryl, I know I've Probably used up a little too much of the time here, but happy to respond to any questions that you all may have.
And I'm also speaking while muted. Okay, there we go. Appreciate all of you participating in this, but Mary, thank you very, very much for the overview. I'm reaching out to the group here to see if we have any questions. You covered quite a bit there. Anyone? Anyone? Okay. Well, we appreciate everything. I think it's been very informative. Obviously, the healthcare industry has had more challenges than most, and during the COVID times, and it certainly is more than most of us want to have to deal with or think about most of the time. But it certainly is. It certainly has been key. We thank you. If there's anything we can do for you in our community, please don't hesitate to reach out to the Daytona Regional Chamber.
I will. Thank you all. Great to see you all. Take care.